Hello, everybody. In our previous lectures, we talked about the science of preventive dentistry, and we mentioned that there are three levels of preventive dentistry, and these are primary prevention, which means that prevent the occurrence of the any oral disease, sorry, and the secondary prevention, which prevent the progression of the already occurrence disease, and the third level, which is the tertiary prevention, which is the level of rehabilitation. And also, we talked in our previous second lecture about the importance of prevention of dental caries, and we mentioned that the two most prevalent and most commonly or most popular oral diseases are dental caries and periodontal disease, which are also called plaque-induced oral diseases. We talked about the etiology of the dental caries. We focused on dental caries because it is more widely distributed in the world than periodontal disease. And also we mentioned that there are different factors that interact together to produce or induce the dental caries, and these factors are dental plaque or microorganism, host or susceptible tooth, diet, mostly carcinogenic diet including sugars, in addition to the time. In this lecture, we'll talk about one of the most important preventive measure in reducing the prevalence and incidence of dental caries, and this measure is called the fluoride in dentistry, or the application of the fluoride or the intake of the fluoride, which termed as fluoride in dentistry. So, what do we mean by the application of the fluoride in dentistry? As you know, WHO mentioned or categorized that fluoride and the fluoridation in dentistry are or is considered as one of the 10 most important public health measures of the 20th century. So fluoride is very, very important in reducing or the prevalence and incidence of tooth decay, and to prevent the occurrence of dental caries. It is in addition to other tools, for example, use of pit and fissure sealants, another preventive measure, for example, home care. So fluoride is one of the most 10 important oral health measures that prevent tooth decay. So what is fluoride? What do you mean by fluoride? Fluoride is a highly reactive substance. Actually, it is rarely found as an ionic form in the natures. It's always react with other minerals to form salts of almost all metals. So fluoride found in throughout the earth crust and widely distributed in nature. It can be found in rocks and soils as different salts or minerals in a combination with different other ions to form different salts and minerals. It can be found in the sea. Some animals and plants also involved or include or contain fluoride ion. For example, animals, it always found in the skin of the certain types of fishes, sorry, and also it also can be found in certain leaves, for example, tea leaves in plants. So this is the distribution of the fluoride in nature. So the sources of fluoride intake in the body. So these were the source of fluoride in nature. So how can fluoride can enter our bodies? The intake of the fluoride in the body it could come from the water that we drink, either natural spring water or fluoridated water. Some or lots of developed countries developed what's called a communal water fluoridation. So we can't get water from the drinking water. Some foods, as we mentioned before, tea leaves and other kinds of food, for example, fish and sometimes other food products contain also fluoride or a small amount of fluoride. Drugs and other dental products, for example, toothpaste, fluoridated water, as we mentioned before, fluoridated mouth rinse, fluoridated supplement, for example, tablet and drops. All these regarded as a source of fluoride intake in the body. Such kind of fluoride source go through the GIT and enter the circulation. Other kind of route of fluoride administration or intake is the pollution from the atmosphere and in the industrial area or an area highly active with volcanic activities, for example. So we can inhale the fluoride, and the fluoride intake go to the lung and then to the circulation, so the level of the or the plasma level will increase through these two different routes, either the GIT or the lung or respiratory system. So after intake of fluoride, it will be, as we mentioned, it will be either absorbed in the GIT and go to the plasma level, which increase the plasma level of the fluoride in the circulation, or it could be absorbed via the lung and go to the circulation as well. So the absorption will lead to increase the plasma level. After that, the fluoride, either could be retained inside the body, our bodies, for example, in soft tissues or in calcified tissue like teeth and bone. And some of these part retained could reabsorb and go to the circulation again, or it could be either excreted inside the body, for example, like saliva by salivary gland, or feces, which remain unchanged. Some of these GIT also go to the feces without any absorption. It could be also excreted through the sweat glands or sometimes in the urine. So when fluoride intake inside the body either could be retained or distributed inside our bodies and mainly go to the calcified tissue, and this is the reason why they call the fluorides is a calcified tissue seekers. It's always seeks about the calcified tissue, or it could be excreted outside the body through the urine and different other kinds of routes. So after absorption of the fluoride or intake of the fluoride inside the body, there are different factors that affecting the rate of this absorption. And the first factor is the physical form of the dose. Actually, fluoride in a liquid form is better and quickly absorbed than in solid form. So the solubility of the fluoride is very important regarding absorption. The dose and fluoride concentration that intake by the body. The high fluoride dose intake mean the high plasma peak or plasma level of the fluoride. In addition to that, Body weight is also very important in this regard and regarding the dose. Increase in the body weight, this will lead to the lower the plasma level, and decrease in the body weight increase the could lead to the increase in the or raise the plasma level after intake of the fluoride. And all these factors will affect the toxicity of the fluoride. The other factor is the presence of food in the stomach. As you know, food or foods act as a physical barrier against the absorption of the fluoride. And if we take an example for that, for example, milk. Milk, it's highly reactive with the fluoride. Calcium ion present in the milk can interact with the fluoride and form what is called calcium fluoride, which has low solubility, and it doesn't absorb by the stomach very quickly. And this is the reason why we give those children suffering from acute fluoride toxicity due to the swelling of, for example, fluoride gel and so on. We give them milk in order to overcome and reduce the rate of absorption of the fluoride and reduce the plasma level of the fluoride in the circulation. The last factor is the gastric acidity. As a rule, the rate of absorption of the fluoride from the stomach is a pH dependent. In other words, with greater absorption at a lower or a low pH and lesser absorption or lower absorption at a high pH. And this is also the reason why we when the patient suffers from acute toxicity, we admit this patient to the hospital and induce gastric or induce vomiting, in order to overcome the high plasma level or the decreased absorption of the fluoride ion inside the stomach and go to the plasma and the circulation. So when fluoride absorbed or intake by the body, it will be distributed in the body and it will reach the peak plasma level after 30 minutes. And after that it returns to its normal level after 3 to 6 hours. During this period it will be distributed to various body, as we mentioned before. It is a calcified tissue seekers with 90% of the plasma in the the fluoride in the plasma will go to the bone, including teeth and other calcified tissue. Fluoride also is rapidly absorbed in bone and teeth, heart, kidney and liver, while it is also slowly distributed to the soft tissue like skeletal muscles, for example, and other adipose tissue. So when fluoride it will go to the mostly or in 99% to the calcified tissue like bone and teeth, and in high amount or high concentration or high dose of fluoride will cause deformity in the teeth and in the skeletal or the skeleton. In teeth we call this dental fluorosis, and in skeleton we call this skeletal fluorosis, and we'll talk about this in the next lecture, hopefully. So the amount of fluoride in the tooth is distributed, as you can see in outer and outer surface, is approximately from 2 to 3,000 part per million. In dentine is less, which is from 1,000 to 2,000 part per million, and in cementum is the highest percentage or the highest amount, including 4,500 part per million. And this is the reason why the outer enamel surface is more resistant to the dental caries than dentine, and it's less resistant to the dental caries than cement. So, how can fluoride become a part of our teeth? Actually, fluoride are deposited in dental tissue in a successive stages during the life of the tooth. And these stages are the initial deposition occur while organic during formation of the tooth or during the period of tooth development and formation of organic and inorganic substance. The second step is deposition of the fluoride during pre-eruptive maturation phase and the source is from the tissue fluid around the tooth in during this period. And the third and or the final stage is the acquisition of the fluoride topically after eruption of the tooth and become in contact with oral environment, for example saliva. So the uptake or the acquisition of the fluoride by the outer enamel surface from different sources, for example food, drink, water, and other topical fluoride or other medical and dental products. All these will strengthen the outer enamel surface and make it more resistant to the dental caries rather than other teeth without any topical fluoride application or less amount of the fluoride composition inside the tooth composition. Sorry. The last subject in this lecture is the excretion of the saliva. And in fact, kidney is the major route of fluoride excretion. We mentioned that some of fluoride will go unchanged and unabsorbed and will be excreted through the feces, which include about 10% about that. The other 90% will be excreted through the kidney, which is the main or the major route of fluoride excretion. Fluoride in the plasma will go to the glomerular filtration. Some of these fluoride ion will be reabsorbed and go to the plasma again, and the large percentage will be excreted in the urine. After 6 hours, 30% of the fluoride absorbed in the plasma will be excreted, and after 20 hours, 60% of the plasma level will be excreted through the kidneys. In adult, 40 to 60% of the ingested fluoride will be excreted. In children, smaller percentage of the ingested fluoride will be excreted through the urine, and this is the reason why it is a smaller amount of percentage, because in children, as we mentioned, that fluoride seeks about the calcified tissue, and in children there is a developing teeth and developing skeleton, so fluoride goes to these tissues and participate in calcification of such developing or growing calcified tissues. This is the end of our lecture. As we mentioned, or in summary, fluoride is a very important ion in the nature. It is present in the nature as a trace element, while in the body, in large amount in the nature, while in our body is represent a trace or small amount. It's always go to the calcified tissue, for example, skeleton and teeth, and participate in small amount in calcification on of this tissue, while in large amount it could lead to a major or dangerous effect. For example, in skeleton, they increase the percentage of, as we mentioned before, they increase the percentage of fluoride in the skeleton will lead to the skeletal fluorosis, and in teeth will lead to the dental fluorosis, while in a small amount this will lead to decrease the incidence and the prevalence of dental caries. And this is the secret of the fluoride that discovered by Dr. Trendley Dean, and this is fluoride in a small amount, which not exceed 1 part per million, could lead to decrease the prevalence of dental caries. And we'll talk about this in the next lecture, inshallah.